Can you believe it? More and more seniors in the US, Canada, and Europe are packing their suitcases to fly to Asia not for sightseeing, but for surgery. A knee replacement in the US can cost $50,000, while in Vietnam, the same procedure costs under $7,000. This is why medical tourism is booming, and the story of George, a 72-year-old from California, shows us exactly why. The burden of healthcare costs in the US. George was once a construction engineer, retired after 40 years of hard work. His life was simple and fulfilling. Morning walks, afternoons with his grandchildren, evenings painting. But at 72, knee pain made even climbing the stairs a painful challenge. His doctor in California diagnosed advanced osteoarthritis. He needed a knee replacement. George sighed. That's a year's worth of my living expenses. How could I possibly handle this? The truth is, the US is one of the most expensive places for healthcare. Heart surgery, $100,000, $120,000. Kidney transplant, $250,000, $300,000. Cancer, chemotherapy, around $150,000 annually. Childbirth, $10,000, $15,000 without complications. It's no surprise that studies suggest nearly 2/3 of personal bankruptcies in the US are tied to medical bills. Medical tourism. A New Hope, George's son, offered an unexpected suggestion. Dad, have you ever heard of medical tourism? Many Americans go to India, Thailand, even Vietnam for surgery. It's far cheaper. Curious George researched. Thailand knee replacement around $12,000, covering surgery, medication, and hospital stay. He learned that Vietnam is emerging as a medical tourism destination. Several private hospitals are internationally accredited JCI. Many provide dedicated international patient services, translators, airport pickup, accommodation. Doctors trained abroad in the US, Japan, Europe bring global expertise home. George thought, if I can receive proper treatment at a reasonable cost, why not give it a try? Preparing for the journey, George contacted a major private hospital in Hanoi. They sent him a detailed service package. Airport pickup, private hospital room with Wi-Fi, fridge, and TV. English-speaking doctors, interpreters for nurses, daily physiotherapy sessions after surgery. The total package was $8,500, still less than what George would pay out of pocket. In the US, his son decided to accompany him. Together they prepared travel insurance, complete medical records, flights. George was nervous, but also excited. At 72, I've never been to Vietnam. Maybe this trip will not only heal my knee, but also open my eyes. Surgery in Vietnam. On admission day, George was struck by the welcoming atmosphere. English greetings from doctors, smiling nurses, a spotless private room that felt more like a hotel than a hospital. The process included a full preoperative check, blood work, x-rays, consultations, a thorough briefing, risks, benefits, and recovery explained in clear English. The surgery itself, 3 hours under general anesthesia. Early mobilization. Within 2 days, George began gentle flexion exercises. The operation was a success. George recovered quickly thanks to daily physiotherapy and attentive care. He later said, I felt looked after in every detail. The cost was only a fifth of what I'd pay in the US, and the service was excellent. Healing and traveling. After 10 days, George could walk with crutches. His doctor encouraged light activity, so he and his son strolled around Hon Kim Lake, explored Hanoi's old quarter, and enjoyed pho and egg coffee. George laughed. Back home, a hospital stay is just stress. Here, I feel like I'm both recovering and enjoying a vacation. This is the unique aspect of medical tourism. It's not only about treatment, but also about mental and cultural enrichment. Benefits and challenges. Benefits. Save 50 to 80% compared to US costs. Increasing quality. Many hospitals with international accreditation, comprehensive services, transport, accommodation, interpreters. Mental relief, blending care with cultural exploration. Challenges, language barriers, worries about complications after returning home. Unfamiliar medical systems and practices. Experts advise seniors to choose reputable hospitals, review patient testimonials, and plan thoroughly for post-treatment recovery. Returning home 15 weeks later, George returned to California. He walked more steadily, free from constant pain. Friends asked, "You went all the way to Vietnam for surgery? Weren't you afraid?" George smiled. Of course I was, but what I feared more was losing my retirement years to debt and pain. In Vietnam, I didn't just heal, I rediscovered joy. Growing old doesn't mean just enduring. It means continuing to explore. George didn't just replace a knee. He replaced despair with hope. The bigger picture, seniors and medical tourism. George's story is one of thousands. Research suggests over 14 million people travel abroad for healthcare each year. Asia accounts for about 60% of this market. Vietnam, Thailand, and India are top destinations for orthopedic surgery, cardiac care, and dentistry. The reasons are clear: costs 5 to 10 times lower, rapidly improving quality. Global standard hospitals, seniors, who often need joint, heart, or eye surgeries, find affordable alternatives abroad. Medical tourism reflects a global truth. Aging and illness are universal. Sky-high costs don't have to be destiny. Cross-border healthcare can bridge gaps, offering hope to millions. George S. journey to Vietnam shows that medical tourism is more than a trended hope for seniors worldwide. It eases financial burdens, restores health, and even turns illness into an adventure of meaning. But here's the bigger question. Can medical tourism truly be a sustainable solution? Or is it only for the lucky few who can travel? In our next part, we'll explore the future of global healthcare. Could we one day build a system where seniors no longer need to cross borders for affordable, high quality, and fair treatment? Don't forget to like, subscribe, share, to follow this journey toward healthier, happier golden years.